that brings us to your weekly capsule of health information. We call it your Healthy Dose. Here in Studio H, we're joined by Kim Bernard, who's MSN RN Care Manager, Hannibal Regional Hospital Home Health, as we talk about home health care. Kim, thanks for coming by.
Morning, Kim.
Good morning.
And let's start out by describing what is home health care.
Home health care is a service that's provided by healthcare professionals under the direction of a patient's physician in the privacy of their own home. Today, with a growing trend toward reduced hospital stays, physicians often order home health services for patients who need continued skilled care at home. The home health care team consists of the patient, physician, patient's family, and nurses and therapists.
So this is not hospice.
That is correct.
This is home health care to get them better.
That is correct.
Okay.
Yeah, it's actually a process of rehabilitation, right? Taking the patient from that hospital setting, they're able to go home, but then continued treatment through this
Right.
program.
The patient would then continue to recover at home.
Now, is this something I would imagine with the physician writing an order for it, this is an ongoing continuation of insurance coverage as well for the patient?
That's correct.
So what kind of services are we talking about? Are we finding everything that's available in the hospital and just kind of shifting it to the home where they're more comfortable?
Most of the services that are available at the hospital can be offered at home.
Mm-hmm.
We offer skilled nursing care, physical therapy, speech therapy, occupational therapy, IV therapy at home, wound care, chronic disease management, pain management, and recovery after surgery, among a few of the things that we do offer.
Now, I imagine it's a great support to the patient, and they develop quite a rapport with your staff.
That's very true.
Why is home health care so valuable to patients?
I think it's valuable because it allows them to recover in the comfort of their home with their friends and family, and it also enables them to avoid large hospital bills for continued hospital stays, allowing them to come home and be cared for in the comfort of their home.
Do you find that the recovery process is faster when the patient's at home versus being in the hospital?
Sometimes I think that is true.
Yeah.
And it also helps keep the patients from going back into the hospital with a team
Sure.
of healthcare professionals that pick up on and assess and address issues that might arise, preventing hospitalization.
So I guess the important thing when we talk about home health care, the patient is comfortable, more so being at home versus being in the hospital environment with the white jackets and machines that go bing and all that other
That's
kind of
correct.
stuff that goes along with it. So are all home health care agencies the same, or is there a qualitative difference?
We are actually, we've actually won several awards in the past, in the most recent years. This year we won the 2012 People's Choice Award. That was the Hannibal Courier Post.
Mm-hmm.
And in 2005, 2007, 2010, and 2011, Hannibal Regional Hospital Home Health won a Patient Satisfaction Award, Best in Nation. So it was for overall quality.
Okay, so that says something that you're going in the right direction, offering this kind of qualitative health care.
And that was actually, our patients were surveyed, and they just basically
they like you.
They like us. They request us back. And that's for excellence in care. So we're very proud of that. We have a great team of professionals, and very compassionate nurses and therapists, and they're just very good at what they do.
Congratulations, by the way.
Yeah, definitely. And Dave from Hannibal Regional Hospital, also here in the studio before we went on the air, was saying, this is a huge deal, and I think you're kind of downplaying it a little bit, but this is really a certificate of excellence in healthcare, and the award means a lot.
It really does, and it's a national award. We've also received a 5-star award from PRC in 2008. And in 2008, a quality award from Primaris, and that's based on patient outcomes versus patient surveys. And folks can go on the CMS, which is the Center for Medicare and Medicaid Services, on their website and look at Home Health Compare. And they can look at patient outcomes and, how well they get better at certain things and how well their wounds heal, and compare home health agencies that way.
That's great. So
Yeah.
they could actually see how well you rank there as well.
That is true.
I'm surprised you haven't won a mobile travel award. So, do patients have a choice on what home healthcare agency that they use? Can they say, "Hey, I want Hannibal and nobody else"?
Yes, that is true. Patients can choose which home health agency they wish to come and provide services for them, depending on what agencies are available in their county.
Okay.
We do cover 10 counties, 8 in Missouri, 2 in Illinois, Pike and Adams in Illinois.
Mm-hmm.
In Missouri, our agency covers Marion, Rawls, Lewis, Monroe, Pike, Shelby, Clark, and Audrain.
But you do come into Illinois also.
We do.
That's
We do.
good. If patients want more information, if folks want more information, how can they get that?
They can call our office. It's 573-221-6515, or check out our website. It's hrhonline.org.
Okay, as a manager of home health care, what would you say if folks are going to go through this process? What are some of the best things that you guys offer? I mean, of course, that personal connection with the patient.
Right. That's very key. That's very key in helping the patient recover. But we take care of the patient and the patient's family. We provide a lot of teaching in the home so that friends and family can help care for the patient in the home. So we provide quite a bit of support and resources for them.
That's really good. That's a good point that you bring up, because not only do you go there and assist with the patient, but you show everybody that surrounds them in their life and in their house what they need to do to help that person get better as well.
That is correct. And then also at the end of those services, we help transition them back to follow up with their physician or any other services that they may need to help them out in the future.
I would imagine you have a great success rate too.
We do.
I think the proof is in the awards that have been handed out because the patients are so happy and satisfied with the service.
Yeah, I think so. And whenever you mention that, Kim does smile.
She starts
and
smiling.
She's not upselling it so much, but it's a very good thing.
It is. It's a great service, and like I said, we're just glad to be there and be available to help people and
Very
to help
good.
these patients get better. And
I'm sure that they're very glad you're there as well.
And get them
I
back
hope
on
so.
the road to recovery. Yeah. All right. Kim Bernard, thank you very much. Appreciate
thank you.
it.
Thanks,
Thank
Kim.
you.
That's Kim Bernard, MSN RN Care Manager, Hannibal Regional Hospital Home Health. And again, more information available. Pick up the phone, call 573-221-6515, or you can visit online, hrhonline.org. And of course, Your Healthy Dose brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group.